KBTC, a viewer-supported community service of Bates Technical College.
From KBTC Public Television Studios in Tacoma, Washington. Welcome to the Steve on the Street podcast, a closer look behind the headlines as public policy and current affairs impact the real lives of real people.
Hello, and welcome to the Steve on the Street podcast, produced by KBTC Public Television's public affairs program, Northwest Now. I'm your host of the Steve on the Street podcast, reporter and photojournalist Steve Kiggins. On today's episode of Steve on the Street, we're talking about America's support for our veterans and the significant changes we've seen this year supporting those veterans. Federal cuts are hitting a couple of ways. Among the benefits the VA provides and reductions in the federal workforce, where some vets have enjoyed an edge on hiring preferences inside an array of agencies. In a media release back in July, the VA announced its plan to cut nearly 30,000 VA staff by the end of fiscal year 2025 through normal attrition, early retirements, deferred resignations, and hiring freezes. Conversely, the VA reports significant improvements reducing the backlog of disability claims. And some of these big shakeups can cause ripple effects for local nonprofits who strive to help veterans who stumble when they leave the service and attempt to reintegrate into civilian life. Nonprofits like Nineline Veteran Services in Pierce County is one of those. Next in the podcast, allow me to introduce you to Nineline from our coverage on Northwest Now. At first look, this office lobby looks just like any other, but take a moment to notice what's hanging on the walls. We'll tell you this space is anything but ordinary.
We are filling a gap that can only be met with the need of support and love that these people deserve.
Sean Durnan founded and leads the nonprofit Nineline Veteran Services. He's a veteran who served in Iraq, and he isn't shy sharing his challenges about reintegration.
Homeless, living out of a car, raising a child, going to college.
He escaped his troubles thanks to a lifeline thrown by peers. It's what spurred the launch of his nonprofit. For more than a decade, Nineline has been serving veterans who need housing, peer mentorship, and mental health resources and more. Since its start, Nineline has grown to offer career and job training, partnering with companies like Boeing and the Seahawks, supporting veterans in 15 Washington counties, and coordinating with similar nonprofits from 44 states across the country.
So if we have a veteran or a family member who's just down on their luck and are having a bad time and they're like, hey, we don't want to call Michigan home anymore, we're heading to Washington. Within 24 hours, we can have a consistent safety plan built out for them, so when they arrive, they're connected with all those local resources.
Late this year, Nineline received a major community-based grant from the U.S. Department of Veterans Affairs targeting suicide prevention.
With my team and this funding, it's allowed me to broaden our case management engagement to those most rural counties who historically and statistically, reported by our U.S. Department of Veteran Affairs, the state of Washington, who have these high numbers of suicides. The work that you do in Pierce County is not unnoticed.
Nineline and other veteran service organizations were recently recognized by the Pierce County Council for their work supporting veterans' transition toward civilian life.
Serving your country leaves an imprint and leaves a legacy and a family, and you never know who has felt that legacy until you open up. And so many of our veterans, even still with everything we're doing, continue to just sometimes not ask for help till it's too late.
Yet less than a year after federal DOGE budget cuts, Durnan worries the need to support struggling veterans and their families will continue needing help from nonprofits like Nineline.
All of these people are going to have to come together to do what we can. I don't think there's a good answer for the next couple of years because we're going to continue to see these reductions happen while we're heading into a recession.
In Pierce County, Steve Kiggins, Northwest Now. Clearly an important organization doing important work in our region, taking care of those who clearly deserve support in ways that are almost too numerous to count. Next on the podcast, listen to an extended interview with the head of Nineline Veteran Services, Sean Durnan, about a major grant recently awarded by the VA that aims to support the most vulnerable veterans. That's probably what keeps you successful here, is you see yourself likely in most of your clients.
I see myself in every one of our clients. I am a professional, but I do take it personally. These are people who, I was them 15 years ago. I came out of the service, post-traumatic stress, trauma, and some of those things will always haunt me. I mean, I'm an Iraq War veteran. There are things I will never share with another living soul as long as I live. But during that time, I came out, and I am the poster child for a bad transition from service. Addiction, alcoholism, fast girls, bad choices, all the things.
Yeah.
I am that guy.
Yeah.
And it wasn't these pre-established systems that helped me out, it was my tribe. It was other veterans, friends, colleagues, service members who came to my aid at my most dire time. Like, I was homeless, living out of a car, raising a child, going to college, and working a graveyard shift. Actually, right here in Fife, Pexco, they actually were the only organization or only employer that took a chance on me.
Wow.
I was working graveyard and then going to school at Clover Park Tech just to get ahead. And so if I didn't have those meaningful support systems like food stamps and basic cost of living support, TANF, access to healthy food, clothing, stuff to go to interviews and to build myself up, and FAFSA, federal aid, to get a education to become well-spoken, well-articulated, and be able to sit in the rooms I sit in today to help those policies be shaped and to offer guidance to those individuals who don't see that every day. I mean, to say that, how do I compare to those people? I was the person. I was living, breathing, eating that, and saying, how do these people get to make these calls when they've never been in my shoes? It's heartbreaking. And to see the impact, the tangible impact that these choices that our legislators, both locally and federally, are making, I'm not going to be quiet about that.
Give me the elevator pitch for what Nineline Services is.
So Nineline Veteran Services is a unified labor of love. We take our most at-risk and at-need military veterans, service members, and their families, and we coordinate care in a way that's just never been seen before, whether it's mental health, suicidal ideation intervention, early postvention, employment opportunities. We offer certifications to our recently incarcerated, homeless, our most marginalized populations, and then we also have a housing program which provides housing services and literal housing that we own, where we place veterans in a shared housing model for 2 years to get them the essential services they need: education, support services, case management, housing, clothes, food, all the basic needs.
Wraparound, really, what you're describing.
It's a wraparound concept, but we've found a way not only to exist using federal dollars, grant funding, things along those lines, but we have a self-sustaining model where we work with local private businesses like Boeing and Moog and Honeywell, and that revenue that we drive in from the services actually supports everything you're seeing here today. And so it's a lot different than any other nonprofit model because we're not heavily reliant on a lot of the federal and state funding, but we are extremely grateful for it. And so I think that's the difference in how we operate and how we move in these spaces. We're client facing and working with that, but we're also embedded in government affairs. We're also working to help the legislation and local politicians understand like what that real practical intervention looks like, and using those evidence-based models from any one of those programs really shows and cultivates that meaningful thing. And then when everything's said and done, we have our ecotherapy program, which takes veterans out into the wilderness, hiking. We may do a day of like skeet shooting, because what veteran doesn't love to go out and just shoot some guns for a day? Yeah. But it's really meeting all those social, emotional needs, and then also those immediate basic needs that we take for granted. So Nineline in a whole, when I always reference it, it's that labor of love, and that's really what it is.
So when you got the news from the VA, $750,000 to help pay for suicide prevention that's got to be a giant chunk of your budget.
It's substantial.
Yeah.
It's extremely substantial, but it's allowed us to expand on our team, right? So we currently serve 15 counties statewide, and we spoke earlier a little bit about this, but 44 states coordinate with us their services. So VA saw
44 states?
44 states nationwide.
Counties.
States. 15 counties statewide, 44 states nationwide. So we are working with providers in New York, Michigan, Florida, New Jersey, the list goes on. And we're leveraging each other's understanding of that geographic area while being meaningful and targeted in how we're bridging the gap in care. So if we have a veteran or a family member who's just down on their luck and are having a bad time, and they're like, hey, We don't want to call Michigan home anymore. We're heading to Washington. Within 24 hours, we can have a consistent safety plan built out for them. So when they arrive, they're connected with all those local resources, whether it's internal to us or where we leverage one of our community partners. So when you talk about like mental health, like we've all been through tough times in our lives, and we need to have those realistic and hard conversations with our friends, our family, our neighbors. And part of that really is, are you suicidal? Are you thinking about hurting yourself? It's not an easy conversation to have, but it's an easier conversation to have than, I'm sorry your brother's gone. I'm sorry your sister's no longer here. People are more likely to let their defenses down and be a little more vulnerable, people that know they care. With my team and this funding, it's allowed me to broaden our case management engagement to those most rural counties who historically and statistically, reported by our U.S. Department of Veteran Affairs, the state of Washington, who have these high numbers of suicides, right? We get seasonal depression as Washington State. You're battling constant variables. And so we're able to go out to these rural counties like Island County and Skagit and Whatcom and Lewis and Navy Region Northwest. I mean, this is Washington State. Throw a rock, you're going to hit a veteran, right? So the $750,000 that's been entrusted to us is really to support those initiatives. Meet the veterans where they're at, build that rapport, have those hard conversations, bring them into the program, screen them, and get them those resources that they need, whether it's basic needs, whether it's high-level needs, whether it's getting them to the next provider and providing them the support to have those conversations, but alleviating the barriers that has led them to this mental health crisis, right? And that's really the goal. And so the VA not only said, we see this, we understand this, but we're going to put our money where our mouth is. And we are grateful for that because they saw the cost benefit of investing in these communities. And so Nineline just represents one of several providers across the country who is doing this work. And the goal really is to see that numerical value drop, right? If we can intervene, create that presence, and then develop those communities full circle, that's a win for everyone.
From where you said, are we kind of, as a whole, like still reeling from some of the impacts of those reduction in force and slash budgets? And what do you kind of envision for the future, the next 3 years?
Oh man, thank you for that. That's a great question. And we're going to see a huge growth in need, right? DOGE is just one example of reduction of government influence and spending and how it's affecting everyone, right? Our most vulnerable populations live in these metropolitan areas and rural communities. These are individuals that have been given these just horrible labels, right? They're milking the system, they're doing this, but when we see the reduction of Social Security benefits for our elderly, these are people who put 60, 70 years into the workforce. How are they manipulating that system? When you see access to basic healthcare services, so EBT, SNAP benefits, these are people who are actually working 1 or 2 jobs just trying to keep food on the table. We're seeing one of the most massive and restrictive reductions in cost support across the nation. So just speaking to Washington State, I don't want to take away anything from my colleagues across the country, but just speaking to Washington State, on the other side of that coin, we just saw the largest tax hike in Washington State history. Cost of living increase, cost of basic needs, fuel, access to healthcare, and housing, affordable housing nonetheless. We're going to see a catastrophic shift. We're already on the cusp of a recession. Now we're going to see the addition of all of these elements come into play. Next 2 or 3 years, my best answer to you is us nonprofit organizations, us community-based organizations, state-based organizations are going to have to pool our resources and ultimately try to fill the gaps. But I can tell you right now it's not enough. I can tell you right now that we pretty much metaphorically and literally shot ourselves in the foot. We're taking essential services away from Americans. We're taking essential services away from families. And we're taking essential supports away, like education and things like that these kids are going to need to build our future, right? We're the adults now. We're the people in charge. And we're literally taking food and resources away from our children. what? And that's where we're at. So my best answer to you is all of these people are going to have to come together to do what we can. I don't think there's a good answer for the next couple of years because we're going to continue to see these reductions happen while we're heading into a recession. Cost of goods are going up and access to affordable health care, housing, all that is non-existent.
Clearly, veterans' sacrifice of service to our country should be rewarded with the benefits they have earned and are entitled to receive. And organizations like Nineline pledge to step into the gap to be the safety net to ensure veterans and their families are supported with the services and support they're promised. So that'll do it for this episode of Steve on the Street podcast. Again, thanks to Sean Durnan for sharing your time in the podcast and the broadcast. And of course, thank you. You could be anywhere, but here you are with me. And your continued support just by listening, I'm forever grateful you choose to be here with me. Thank you. Northwest Now covers the issues and stories, the people and places that reflect and define who we are and where we call home. Join our broadcast each week, Fridays at 7:30 p.m. on KBTC Public Television. Once more, I'm reporter and photojournalist Steve Kiggins, host of Steve on the Street podcast. Until next time, cheers.